you have so much intestinal cramping and spasm, you certainly won't want to experience that unpleasant experience. But if you typically ingest or start reading labels and see how many milligrams of, or how many grams of fiber you ingest a day, if you're only eating 10 a day, just make a goal every 2 weeks to increase it by 5 grams. And by doing that, not only will you help control blood sugar level better and fat level better, but it's a good way to help you lose weight, even if you want to lose weight. Because again, those soluble fibers bond themselves to sugar and inhibits the absorption of a lot of sugar in our bloodstream. Niacin, vitamin B3, again, lowering cholesterol, helps reduce LDLs, helps lower triglycerides. Artichoke leaf inhibits plaque formation, again, reduces cholesterol, increases the good cholesterol, the HDLs. Yeah, garlic's another important supplement to help reduce LDL oxidation, cholesterol, triglycerides. Curcumin. Gugu lipid is a fiber from a muku tree. It's an excellent source of fiber. Green tea is good for reducing cholesterol and oxidized LDL levels. Omega-3 again, vitamin E, and lecithin, which is a soy product, helps reduce cholesterol levels.
Is all that in this?
Oh, that's in there, yeah. We try to make these handouts good enough so you wouldn't even have to come to listen to this. Yeah, green tea is good for, it's a great antioxidant. It's good for a lot of different things. It doesn't have a lot of caffeine in it either. But all that information, we try to put these handouts together in such a way that you wouldn't even have to listen to me speak about this to take something away from this. But traditional treatment of cholesterol. And I wasn't even going to get into statin drugs, and I'm not going to get into it in a lot of detail. But basically, what they do and how they work, they inhibit the activity of an enzyme, which is called HMG-CoA reductase enzyme. It basically blocks the liver from producing cholesterol. Statins also reduce the production of another important, coenzyme in our body called coenzyme Q10, and another enzyme in our body called dilacol. CoQ10 is important because it produces ATP. And if you remember from 8th grade science class, all the cells in our body, as I said, the trillions of cells have these little organelles in them called mitochondria, which are the powerhouse of the cell, which is, I think, how all of us learned it. But anyway, the mitochondria actually produces ATP, which is actually the energy that's produced by the cell. So if our cells didn't produce ATP, basically there would be no energy produced by the cell would die. And the heart, which is just a muscle, requires a huge, huge amount of CoQ10 to function normally. Our respiratory system requires an enormous amount of CoQ10 to function properly. Elastin, collagen for nerve function, muscle function, ATP, CoQ10, is all extremely important. Some of the side effects of not having enough CoQ10 is muscle wasting, muscle weakening, severe low back pain, severe muscle pain, neuropathy, inflammation in tendons and ligaments that can lead to rupture, and low dilacol levels. Dilacol almost acts like the brains that we have in our computers. It's kind of like it affects how the brain of the cell works, and actually can cause cellular chaos. So statin drugs not only inhibit the production of cholesterol, but they also inhibit the production of CoQ10. So any patient taking a statin drug, should be taking coenzyme Q10 along with that, because what we've noticed and what we've seen, looking at the medical literature, is that more and more patients are dying from not so much heart attack, and there's been a slight reduction in heart attack levels with the use of statin drugs, but more patients are dying from heart failure because the muscles themselves don't have the energy to contract or pump blood. So actually the cell can either get sick or it dies, and you have heart failure or cardiac myopathy. Muscle pain or weakness, we see this in a lot of patients. And I remember when the statins first came out back in, I think it was 1987. And after a couple of years of them being used, we'd have patients come to our office that we'd been treating for back pain or leg pain for years, and we'd do our evaluation, and we really didn't find a spinal problem, but in fact, what was happening was they were taking a statin drug because of depleted CoQ10 levels to such a severe degree, they were having severe pains in their legs. And finally, once we realized, and once more study had been done concerning statins, once they were taken off the statin drugs, the leg pain disappeared and they were fine again. The problem with statin drugs and muscle pain is that a lot of times patients don't immediately get problems with their muscles. It can be a year or 2 or 3 years later. And sometimes it gets to a point where there's so much damage to the muscle that the muscle can actually rupture and release myoglobin into the bloodstream, which can cause kidney damage and cause neuropathy, which is nerve damage, and a whole host of other things just because of the toxin that's invaded their blood system. Statin drugs also can cause dizziness, cognitive impairment, cancer, pancreatic necrosis, and can even, contribute to depression. So even though statins can and do have some positive benefit, the negative, I think, outweighs the positive in that you can do some things naturally, nutritionally, and changes of diet and exercise to control cholesterol and LDL levels without taking these drugs. And that's basically it. We're going to be doing in the next couple of weeks a cholesterol screening. Dr. Worm will be doing that, so we'll have that posted. If you want to sign up to have your cholesterol tested, we'll do that. If you have it done, ideally what we'd like to do is do it, first thing in the morning before you eat anything. So. But anyway, can you change and alter cholesterol, LDL, HDL, and triglycerides? Well, certainly you can. And again, through diet, exercise, and nutritional supplementation. I got several supplements that we've been manufacturing. We haven't been manufacturing. We use a company that manufactures supplements for us, and we have been for probably the past year, that have actually have their own formulations, and we've also created some of our own formulation with them to treat inflammation, to treat cholesterol. We also have 3 fiber products that we use that I've worked very, very well with different patients. So if you ever want any information about those, we can get you some tab sheets.
How do you get your system to tolerate fish oil?
Well, the key is the kind of fish oil you're taking. Most people.
Well, got some from you one
Yeah.
time. Couldn't handle it.
How long ago was that?
Oh,
Was that the Nordic Naturals?
it may have been.
Was it over a year ago?
Oh, yeah.
Now,
And then I got some from the drugstore,
Yeah.
pharmacy.
Let me give you a sample of some of what we're using now.
It just tears
Does
my
it burp you up or
I think when you first started handling
It
it, I
just
think.
tears me up.
what? Like loose stool or diarrhea or?
Kind
Gas.
of loose stool.
Or
and
gassy?
got gas.
Do you have the
and-
same thing, Glenn?
Oh, yeah.
And a
Yeah.
burning sensation after I have a bowel movement.
Yeah.
My
Well, what we have to do is stair step your dose level.
I that's my main problem with gas.
We used to use Nordic Naturals, which is a very, very good fish oil product. It's pure, it's natural, but occasionally there are some people that don't seem to tolerate it very well.
I
So
take it because Dr. Smith recommends it for my eye problems.
yeah, it's great for everything. So let me give you a sample of the newer products that we are using now. And try it for 3 or 4 days. And if you happen to be one of those people that just can't tolerate it, most people burp fish or have a lot of gas rarely because they're eating fish oil or ingesting fish oil that's rancid. It's been sitting on the shelf for a long time, and the best way to know that is stick your nose in a bottle and take a big sniff, and it stinks. But we'll try a sample of that, and if you find you can't take that, our next step might be better off to maybe take flaxseed oil or flaxseed and sprinkle it on food. Eat it that way. At least that way you can get some of the omega-3s, EPA and DHA in your system. The only reason I don't usually use flaxseed much anymore because the therapeutic part of what's in the fish oil is the EPA and the DHA. And omega-3 of fish oil already has it in that form. Flaxseed, it takes a couple of chemical reactions in your body to break it down into EPA or DHA. So you get the benefit, the positive therapeutic benefit from that. So let me give you some different stuff to try. This stuff is ultra pure, and I don't think, and I've been using it for a year, I've had any patients that have had a problem with that. Whereas before, with the Nordic Naturals, when we were using those, maybe 1 out of 80 patients would have a problem with it, but it really wasn't that common even then. So let's try that and see if that doesn't help you as well.
I don't know who made your drink, but it's tasty.
You know what that drink is? That's just this. This stuff is called
Strawberries.
Pure Whey Beverage Meal. And what this is,
Oh, really?
it's got protein, it's got fiber, it's got a multivitamin, and it's got a real mild liver detoxifier in it. And they just put frozen strawberries and bananas in that, mixed with this drink, and that's what you're drinking. So if you don't like to take vitamins as a pill, that's just a good, supplemental drink you can drink every day. We use that a lot of times.